Hello, my name is Crystal Petrie, and you are watching another episode of the Crystal Petrie podcast. Today, we are going to learn about some chronic conditions like sleep apnea and also swallowing issues. Not only are we going to learn about those conditions, we're going to look at some holistic approaches to treating them. So, wherever you are, whatever you're doing, make sure you subscribe to my podcast right now. And here to educate me and you, we have Alizah Shahar. So, welcome to the podcast. How are you?
Great. How are you?
I am good. Thank you so much for being on this podcast to talk about these issues. I feel like so many people deal with, especially sleep apnea, right?
Absolutely. Well, you could say a pandemic of sleep apnea diagnosis.
Yes,
Um, but what's interesting is that, a lot of times people attribute to just snoring or weight. And you
right.
have people sometimes with the best, who are thin, who are slender,
Mm-hmm.
um, who are suffering it as well.
Right. Is there a cause to sleep apnea? Because I know, like you said, most people think it's because of your weight, or they just think, oh, he or she is just snoring really bad. But is there a cause to that?
Well, some of the things I could tell you in regards to like the clients that we see at Tassel Health.
Mhm.
Many of the biggest commonalities is a lot of them are suffering from jaw issues, jaw dysfunction.
Okay.
Okay. That's kind of like the screaming muscle before anything else. Many of them suffer that as well. But it has to deal with your decreased airway patency. When you're on a CPAP, that's ventilation. Your natural ventilation system is literally your diaphragm and your pelvic floor. That's how you
Really?
yes. It's
Okay.
the pumping process of the ventilation system. Okay. That's
Hmm.
called what we call diaphragmatic breathing. If you've taken a Pilates course, they tell you to breathe stomach breathing. And a lot of times it's still hard for people to go ahead and do. But when they put you on a CPAP, that is actually a replacement of your own ventilation system because it's not giving enough oxygen. Yes.
That's what it is. Okay.
Okay. So when you look at
Yes.
it, they need a ventilation system because they have high, what we call apnea and hypopnea scores, where they're skipping basically breaths while they're sleeping. And so anything above 5 is within functional limits. Anything between 5 and 15, we're looking at mild, but really going towards the 15 end, we're going mild, moderate. And then
Hmm.
anything above 30, you're looking at chronic to severe. And there's people with very severe cases where we say in the red,
Hmm.
where they're at 100, and where that's how bad it is. So they're not getting enough oxygen. They can literally die in their sleep. Okay.
That was going to be my next question, Alizah. Like, can people die in their sleep from sleep apnea?
Absolutely. But there's so many things outside of just the ventilation system. There's a breakdown in the whole system. That's one piece of the puzzle. Okay.
Okay.
And so it's not like the CPAP. The CPAP helps you. Of course, we need the help, especially if you're at 100 apnea, a PHI score. You need that help, and when you're chronic, you need that help at the beginning. But there's also muscles that are involved. So there's decreased weakness in your throat muscles. I'm going to just put it in real layman's terms, in your throat
Hmm.
muscles and your oral muscles. But there's also a decrease in your swallow when you have issues with sleep. And
Hmm.
no one's put that correlation. There's a few studies out there as well. But seeing these clients too, you see that their swallowing is down. Why? You're sleeping with your mouth open a lot of times when you're having these breathing issues. And so going into the airway system, now we're going to the upper respiratory system. Okay. So we have ventilation and
Hmm.
respiratory. In the respiratory system, we have ventilation, and then we have the upper respiratory.
Okay.
Okay. So when we're looking at the upper respiratory system, we're supposed to be breathing through our noses. Why? Because our nose have natural filters, like hairs. It has hairs in your nose
Right.
to filter out the bacteria to come from coming into our bodies, whatever foreign objects, things like that. But when you have any form of obstruction in the upper airway, and then you don't have great ventilation, you're breathing through your mouth and you're like this. Or sometimes our mouth is what I call closed, and
Hmm.
it drops because you're trying to open up the back of the throat because
Okay.
muscles are collapsing. And we relax when we're sleeping, everything relaxes.
Yes.
So when the muscles begin to relax, we start closing off the airway in the throat area, in the nasal area. So guess what? The body's going to survive. And so sometimes to open up that area, we're clenching while we're sleeping.
Mm-hmm.
We're grinding while we're sleeping to open up the airway, to hold the tongue from falling in the airway.
What?
Yes.
I had no idea. This is scaring me. This is scaring me. I had
Yes.
no idea.
So the way you swallow too, and the way your tongue is in position, you either have positive pressure or negative pressure to even in your digestive system. It even goes into your digestive system. Let's put it that way, to
Mm-hmm.
kind of go into reflux. So we see that in our clients too, reflux, chronic cough. Um, Definitely where they come in, the initial part that they come in is, I have TMJ issues. Oh yeah, by the way, I don't wake up restless. It's a side effect,
Yes.
but and so what you see is too is you need that positive pressure in your swallow to be able to close those sphincters for the reflux not to come up this way. You need
And
positive pressure.
what does TMZ stand for, that acronym?
TMZ or TMJ?
Oh, TMJ. Excuse
Yeah,
me.
it's
I'm thinking of.
temporomandibular joint disorder or joint.
Okay.
Is this right
Okay.
here? TMJ. Everybody says TMJ,
So
but
right under
really
your ears.
no. So open and close your mouth.
Uh-huh.
It's the little
Oh,
hinge.
yes.
That's
Okay.
the
I feel it.
temporomandibular joint. Okay, and that's where you hear the clicking and the popping and sometimes there's deviations when you open and you close.
Mm-hmm.
You feel like it pops out sometimes. So what ends up happening is, if that you're chewing atypically and you're experiencing clenching and grinding and all these symptoms, and this is not in the right position, you start also deteriorating that joint.
Mm,
So then we start
okay.
to go to a structural issue as opposed to a muscular issue.
Oh my goodness.
Yeah, so
Oh,
it's
I am. This is going to be a good podcast. This is going to be a
so,
good podcast.
so one of the things that amazes me is that our bodies give us a lot of signs. Okay,
Mm-hmm.
signs of something's
Yeah.
wrong. When you start getting that jaw tension, the clicking and the popping, that's a warning. When it starts going into pain, and then you start really hearing that crunch, you're going past that threshold of, I can't compensate anymore. Now there's a breakdown in the body. Okay,
Mm-hmm.
and what's amazing to me is that many people put this, okay, I can endure through this pain. I can endure through this pain. But if this is not fixed, it only gets worse with time.
Yes. Like anything else, if you don't
Yeah,
fix it, if you don't fix your car or the leaky
exactly.
plumbing, it gets worse.
It just gets worse. And so instead of enjoying the last whatever so many years of your life, because we see infants to adults, and in a sense of TMJ, not so much, but in a sense of swallowing, which is more of a prevention for later on. Okay.
Mm-hmm.
But we see clients from all ages. So we've seen the ones that didn't know what to do, ignored it, whatever, at 50, 60, 70 years old. And then you see the younger ones, young professionals and professionals coming in their 20s and 30s, which they're taking care of it right away. But when you're younger, it's kind of like, oh, I'll shake it off and keep going.
Mm-hmm.
And then when you hit your 30s, you realize, I can't shake this off like I did when I was in my 20s.
Yes. Yes.
Okay. And there's just so much, there's so much, out of this dysfunction, so much disease is also impacted and created, because if you can't get enough sufficient oxygen into your organs, what happens?
Won't
Okay?
they eventually decrease and stop working?
Exactly.
Yes.
You start having other issues.
Yes.
So the breath is 100% important for everything. And people say, okay, just to breathe to sleep. No, you need coordination of breath to swallow and to
Mm-hmm.
speak. And everybody wants to speak by an inhale, and you speak on exhale.
Really? I don't know when I speak.
So you
I don't
breathe
think I ever
in.
thought about it. I never thought about
Yes,
it. I just speak. I don't think any
yes,
of my listeners have ever thought about it either. We just speak.
yes, yes. And so, and it's your ventilation system is what we call your core. You're really utilizing your core muscles,
Okay.
but you have to be able to utilize them properly. Just at rest, like right now we're speaking, being able to
Mm-hmm.
go ahead and do that. What ends up
Yes.
happening is people, so for instance, if we go to the diaphragm, so the diaphragm is like this cup, like I call it like a little cup, like here, right
Okay.
underneath the lungs. When we bring down the diaphragm, we have more space in the lungs to take in more air. Okay, that's how we get more air.
Okay.
But it says, okay, I'm gonna bring down the diaphragm, but the pelvic floor
Right.
goes down too. It's a pump. When you
Okay.
exhale, I always tell people when you exhale, this is over exaggeration just so they can learn to use the muscle. Act like you're going to the bathroom.
Oh,
And it
okay.
automatically gets the diaphragm to go up. Okay. So that's the pump. What people are doing today, and it has a lot to do with the way we eat, okay, is they're using accessory muscles here to open up the lungs. And you're not doing that because that's not what they were made for. So you're breathing
Mm-hmm.
this way. You're trying to open up the lungs here by
Yes.
pulling up the shoulders, the chest muscles, instead of bringing down the diaphragm.
Yes.
So I always say this is my little analogy. I'm like, you've got this beautiful car,
Mm-hmm.
it has a wonderful motor, but you decided to put pedals on it and pedal around Houston. So it's like, you live in flat Houston. The only way you're gonna elevate those muscles in the chest is if you're walking downhill.
Yes.
Okay. And so I said, you decided to take your body and start pedaling around town and wondering why your muscles are screaming for help.
Mm-hmm. And you have no idea because now you're leaning on other aspects of your body to help.
Yeah. So it's systemic. When it comes to the jaw, it's systemic. It's not it's not local. It's all systemic. So and with a lot of things, it's systemic as well. So the jaw is primary to the tongue.
Mm-hmm.
The tongue muscles and all the muscles of the tongue and the airway, they share the same muscles. So when there's dysfunction in one, there's weakness in the other. So when you have a dysfunction in your swallow, you decrease airway patency.
Okay. Now, isn't
Right?
your tongue a muscle? Is that
It's a
correct?
muscle, it's its
Okay.
own organ. It's what we compare it to the tentacle of the octopus. That's our tentacle. That's our human
Okay.
tentacle. Okay.
Okay. Yes.
Okay, because we
Yes.
can
I get
touch with
that.
it, we can taste with it. It's supposed to move on its own.
Mm-hmm.
And it's positioned at the roof of the mouth. What is happening to many people, they're like, oh, I have the tongue in the roof of the mouth. They have this part, but the back part is like down here, like this, or
Like
it's down the
diagonal.
middle between the teeth. Okay. So then that causes atypical swallowing, which we call, everybody's heard of a tongue thrust. And they relate it to tongue tie, which we'll touch on that a little bit.
Yeah.
But it's not only tongue tie, it's when you're compensating, when your muscles are compensating too. When you swallow, you are supposed to push up and then squeeze so that the back of the tongue goes up and undulates into the digestive system. Okay.
Mm-hmm.
When you tongue thrust, you're taking one extra step. You're pushing forward. Instead of putting the pressure upward, you're pushing it anterior. Guess what happens to the teeth? You're putting
Wow.
4 pounds of pressure into the teeth every time you swallow your saliva, which we can swallow our saliva from 1,500 to 2,000 plus times per day.
Mm-hmm.
That's not even with food, drink, or anything else. So you're pushing against the teeth. So everybody's like, yeah, 4 pounds of pressure on the teeth, but there's muscles connected to the jaw joint. So you're pulling that jaw joint forward on top of using the wrong accessory muscles. So
Yes.
they come in with headaches, neck pain. Of course, they're clenching and
Yes.
they're like, it's worse. And of course, and then you start to look at the whole body because we look at the entire body. Because if we just look here, we're going to fix it locally and it's going to go right back.
And it comes back worse.
Mm-hmm. Because your body's going to compensate. Muscle moves bone. Okay. So we look at the whole body. We have to balance the whole body. Take away all the imbalances, create your new normal because you've been living like this for who knows how long, 20 years, 15 years, whatever the case may be. you've been living like this for such a long time, and there's never been a direct solution. So there are some solutions out there.
Mm-hmm.
I've learned that there's things that work for a time, which I call band-aids, but they don't resolve the problem. So a lot of times you'll get TMJ specialists that do appliances only, where they'll jut the jaw forward for airway. They'll keep they'll do a mouth guard. Some people have done Botox, where it alleviates for a moment, but you have to do for the rest of your life Botox.
Wow.
Okay, because you're not fixing the problem.
You're putting the Band-Aid on
You're
it.
masking it. That's it.
Mm-hmm.
For a time, and it becomes a very expensive painkiller. Okay, and so if you're really looking to resolve the issue, you have to go with. So if I put an appliance on a body that's not aligned,
Mm-hmm.
you're putting pressure on something that already has tension. So people come in and they're like, I'm wearing this, but at least that my teeth aren't grinding, but I still have headaches. I still have this. I still have that. It's
Yeah.
not fixing the problem that they're trying to solve. It's just alleviating the symptom.
Wow. Okay. We really just hopped in here. Okay. So I know my audience is like, okay, who is this person? So that's given all of this factual, wonderful information. So, Alizah, tell us, how did you get into this space? What's your education? What's your experience? What led you to this?
So I've been a medical speech pathologist for 20 plus years. But I am as a medical speech pathologist, I dealt a lot with swallowing, and I'm also a researcher. So part of me, my practice is my personal practice as a clinician has always been very evidence based. And in order for me to help my patients, I have to figure out, okay, I'm coming to a plateau. Why am I hitting this glass wall we have to get through? Because me personally, as a clinician, I'll get bored if I don't see the result.
Okay.
That's just my personal thing. So if you
Yeah.
want to know how I got into this, when I was younger, back when I started, it was just kind of like, oh, I want to help these people. What can
Right.
we do? But also, I was suffering my own TMJ issues. Okay. And so while I was working with my patients with swallowing, I noticed they all had the same commonalities.
Yes.
So with my research analytical brain, you start documenting and you start seeing, wait a minute, they have a swallowing issue, but they have this, what's going on with their jaw. These are all things that are taught to us in school, but the connecting the dots was not taught.
Mm-hmm.
So I had to connect the dots with myself and with my patients to be
Okay.
able to alleviate the issues. So being able to go from there, I said, okay, I want to be able to work more with the body. We're trained on the body, but to really work with the body to kind of get a little bit over that scope that we have, I went and I got certified in craniosacral.
Wow.
Just
Okay.
because I wanted to as a tool. I don't I don't advertise as a craniosacral therapist. I hire them, I train them in our method because I understand it, but I did it as a tool to help my patients.
Okay.
Okay, because it was needed. It was the missing piece that was needed, because sometimes it's hard to say, hey, I need you to work on this and that, because everybody's looking at things from a different perspective. So part of doing that, I started to implement everything that I was learning, and whatever approach I can get the end goal is what we look at is not so much service as it is, what is the problem? We are trying to solve this problem. So what is the achievement? What are we trying to achieve at the end of the day?
Mm-hmm.
This is our goal, and this is the outcome of that goal. Okay. So that is our focus. That is our philosophy here at Tassel Health. And this is how I got into it. I resolved my own issue.
So were you able to fix your TMJ?
I was able to fix my TMJ issue. And then if anytime when we will lead into stress, anytime there's stress, my patients also know what to do so that you don't ever have to go back to living that way. Because it's an awful way to live. You're not
Mm-hmm.
sleeping well. You're not, you're not, you're there like 50 to 75%. You want to be 100% for your family, for yourself, for your work, because it can impact over time your performance. Brain fog, who wants to deal with that?
Right. And a lot of
Who wants
times
to deal with
you're in it for so long, you forget that it's a brain fog. You think it's
exactly.
normal.
It's and that's so true because when I first do my consultations, they were like, I just thought I had to live with it.
Oh, wow.
Yes. And there's many people who think that they have to live with it. And no, you don't have to live with it. Your body is so amazing to be able to heal itself. Okay. But you have to have a manual. You have to know what that is. And so with my patients, yes, we were targeting swallowing, but we targeted all the other issues before we even got into swallowing because they were primary to that issue.
Mm-hmm.
So then it was going down a whole rabbit hole with my clients. And when they were getting better, I was getting better. I was like, okay, this is wonderful. Let's keep
Yes.
going. And so Tassel has been open for the last 4 years here in Houston, even though I've been practicing for 20 plus years. And our program has even evolved since then, doing a lot of clinical based research. We do a lot of case studies as well when it comes to the swallow complex. I could tell you this. I have a patient, and I've posted it on our page and on our social media. 61-year-old patient suffering 15 years on the CPAP, chronic.
No.
Yes, she was. Her apnea scores were 37.7. So that's on the severe end. She was in the orange red area, and she chronic cough, couldn't, like, her husband and they're empty nesters. Okay. And so he had been taking care of her. She couldn't even get up to clean the house.
No.
Couldn't even, like, she would be winded, taking a nap, like it was just too much. Walk the beach, go from the car into the supermarket. So imagine 61, that's, to me, that's not that old. Like you
That's
still
not
got
that old, but
you
I'm
got
thinking he suffered like that for 15
15
years.
years.
That's what I'm thinking.
Yeah, so she was in her 40s starting to suffer this.
Yes.
Okay. And so when I remember, I'll never forget the first day that I saw her. And it's very common with those that are struggling with breathing or even with some jaw issues as well. But she came in for jaw issues and her sleep. Those were the two reasons. Then when we started to unravel some of the other things that were going on, like her chronic cough, she was diagnosed with chronic pulmonary disorder too. And by the way, not everybody reveals everything that first.
Yeah, they got to trust you first. They got to
Yes.
trust you first.
So as I start to connect the dots, and they're like, "Oh, by the way," so as we start to connect the dots, and so I say this because I'll never forget the first day that I saw her. She was gray. Her skin was gray. We have pictures. Her
Yes.
skin was gray, and when I saw her, I was like, "This is an example of the living dead." Because if you don't have enough oxygen coming into your body during the day and you're
Yeah.
looking gray, that's almost corpse-like.
Wow.
Okay. And so when I saw her, you could tell just even talking to me, she was getting winded. Okay. And like I said, there's people severe, even more severe than 37.7.
Oh my
Okay.
goodness. Yes.
So I'll never forget this. And she got started with us. She got started with us after 15 years of using CPAP, between 4 to 6 months, we weaned her off of CPAP completely. And we took her through the process. We had to work her body. So we have a 3-phase process. Let me just put it, we work the body, we work the airway, and we do strengthening as well for the functional aspects. And then we go into function, because in order for us to maintain this, because everybody's fear is, what if it goes back?
Yeah.
The way you maintain it is by what you do every day. What's your quality of life? We eat, we speak,
Yes.
we communicate, and we sleep. Good sleep, good food, and good conversation.
Yes.
Okay? Great quality of life. But when you can't have any of those three, your quality of life goes down. But when you're able to function in that proper position in those 3 areas, you maintain your body. And if it ever deviates, you know exactly what to do because you know the difference is your new normal.
Yes. Now you can feel it and you can see
Yes.
it.
And when you're
Yes.
functioning properly, you're continuously increasing the strength of your muscles in the proper position. What I always say they were created to do. Your
Yes.
body's an organization. Think about any company. If If the secretary is doing the president's job because the president can't do the job, it's going to be a mess.
It's going to be a mess. And everybody's going to feel that.
Uh-huh. But when it's a healthy, what we call a healthy company, is when everything's functioning in a good system. Everybody's doing what they have to do. Same thing with your muscles.
Yes.
And when they're screaming, it's because they're saying, hey, my teammate over here is sleeping. I'm overworked.
Mm-hmm.
Okay.
Yes.
That's my little way of explaining.
I like it. I like it. I completely get it. Are you accepting new clients?
Yes, I am. I do accept new clients. We have, if you go to our website, you can schedule either a discovery chat, just to kind of talk and find out more information, or just go right ahead and schedule the initial exam.
And what is your website?
It's Tassel Health. It's TASL health.com.
Excellent. Excellent. So if you guys who are listening are experiencing any of the stuff that we are talking about, please, please reach out as soon as possible. Okay. So what are some signs of tongue tie? But first explain to us what is tongue tie? And then what are some signs of tongue tie and why is it important to treat it early?
Okay. So tongue tie basically has to deal with the fascia in the body. So I want to explain what everybody's like, well, what is fascia? Okay. So my closest explanation that I can give so people can understand is when you're kind of like washing the chicken, like you're in the kitchen, you're doing chicken and you pull the skin off. You ever seen that little white kind of that's fascia. It's connective tissue. It connects and it sends messages into the muscle. Okay. So when it comes to the tongue, the fascia starts at the base of the skull, not just here. It's the base of the
skull. Okay.
It envelopes the tongue, goes down into the sternum, into the diaphragm. So now if you have tension, I always say this, I wish I had a rubber band right now, but if I put a rubber band between my fingers right here, right? And I pull the middle of that rubber band down, what happens to my fingers? Do they stay straight?
No, they go in.
So what happens to your head and your body? We start having the forward head posture.
Okay.
Okay. Now you have anterior tongue tie, which is the most obvious tongue tie. And this is what most physicians can identify early, but it's the posterior tongue tie that physicians don't identify very early.
How does tongue tie present itself? Is it a way you speak or eat?
Oh, yes, absolutely. Okay. So a lot of times, let's say an adult, because with a child, I can go into swallowing, suctioning on the breast, sometimes taking in a lot of air, they're suctioning, but the way they're suctioning and the way the muscle movement is in an infant is also just as important. So a lot of times what they're focused on is that the child doesn't become failure to thrive. They're taking enough nutrients. But what's missed is when I'm looking at the oral motor movement, because that's the basis for speech later down the road. Okay. So it's how you suction, how you move your head as a baby. Those areas are critical for speech sound production. Okay. So for an adult who comes in, who's probably had it and never identified it before,
right?
What you see is a lot of times they feel like their tongue is too big for their mouth. Number two, they get stuck on words when they're trying to speak.
Okay.
So they can speak just fine. Sometimes you hear them. There's no like speech sound errors, but they start talking and the tongue is like almost like a tongue, what we call tongue tie. When they're talking, they start stumbling on words.
Okay.
There's a tendency to be mouth breathers because the tongue is low lying. They tend to have either orthodontic issues as well.
Wow.
Okay. Because we talk about narrow palate. So when they say my tongue is too big for my mouth, it's actually the casing didn't grow around your tongue because your tongue is your natural retainer.
And this is something that can be corrected?
Absolutely.
Wow. How? I want to ask how, but I know it's a lot to it. So maybe a condensed version of how do you correct that?
I'll do two ways, okay?
Okay.
When you have anterior tongue tie where it's way at the tip, we would recommend a release. We do not do the releases here. We do have physicians in the area that we do recommend the release to be able to go through. But there's a couple of things we have to look at. Your
Okay.
palate size. Here at Tassel Health too, what we do is a lot of times, especially for the developmental, we actually like children under like 17 years of age, you're still growing. That's still being able to spread. We work on that with the tension, and we get your body to naturally expand and get your tongue up there to keep it. However, sometimes we do need expanders because the body just says, okay, this is enough right here. And to be able to expand it with expanders, we do recommend that once they get started in treatment, we put it in a parking lot just in case it's needed. If it's not needed, we keep going. Okay. So surgery is definitely an option when it's a posterior tie. There's a possibility that we could also release the tension and you don't need surgery, but surgery is always a possibility. Okay. And it's a 12-minute procedure. Your mouth heals like this.
The surgery is a 12-minute procedure? What? I never heard of anything like that.
It's a 12-minute procedure. Your healing process goes through. We do the post-operative care and everything after it. You heal very quickly.
Wow. Is there pain or minimal pain? Maybe
soreness, just like soreness, because they went in there. But one of the things that especially with anterior tongue tie, you start to feel a release here in the in the
back of your head.
You start to feel a release. And then we continue to train on what you have to be able to do to keep it that way and make sure there's no scarring as well.
Okay. Do you take insurance or how?
We do not take insurance just because we implement so many various procedures for this. They don't cover anything. But what we do is we do provide you a super bill for reimbursements. So a lot of our patients get the reimbursements. We do have payment plan options to make it affordable for various budgets.
And then most, I know not all of them, but most insurances will reimburse for that.
Oh yeah. So from what we know, just kind of gathering the information, depending on your insurance, it'll cover from 25% to 100%. We try to get as much as the positive codes for you. That's as far as we go. You have to fight out the rest with your insurance company. But we at least try to provide that for our clientele, because when you look at it, we're providing various modalities to be able to get your systemic to treat the system. And so being able to go ahead and do that, you are going to pay out of the wazoo trying to go to so many different people who may not cover or communicate with each other.
Right. Okay, let's talk about jaw misalignment. Explain to us what that is and how does that contribute to chronic headaches?
Okay, so with jaw misalignment, it's basically with the way your jaw is functioning, as well, and the way your jaw is positioned. So when your jaw's not positioned in the proper position, in the sense like it's underbite, or you have recessed jaw, where it's back, where you're bringing it back here, recessed. What ends up happening is your muscles consistently compensate. So either they're pulling more on one side where you have more like bilateral or unilateral weaknesses in your jaw. That's what it ends up causing. So where our main jaw muscles are the temporalis muscle, this right here, this muscle right here.
In your head?
Yes, that's part of your jaw.
What?
Yes. Here, right here, your masseter muscle, and then you have your
like your cheeks, your cheek muscles.
Right, your cheeks are here. Go back, soft, and then you're gonna get right into where it gets a little bit tougher.
Oh yes, I feel
That's your masseter muscle. That's your jaw muscle.
Okay,
and then you have your lateral pterygoid muscles right in here,
and that's right behind like the L or the kind of L right there.
Right in here.
Okay.
So those are the gross, like the major muscles to be able to open and close your jaw. Then the more minor muscles are the digastric down here to open. So a lot of times
right under your chin.
Open your mouth. Everybody does this.
Oh my God. We look crazy.
And they use all these other muscles like this. And I don't mean to, but this is what
crazy.
I'm like, Okay, this is what we're going to do. And I have to literally touch here. I said, pretend this is a hinge. We're going to, and close.
Clothes. Okay.
Well, if you see my tongue goes down with the jaw. Many people do this. They open their jaw with their tongue going back.
So when you open your jaw, your tongue is supposed to go down.
Your tongue is supposed to be relaxed, not doing any work.
Okay.
Okay. But what ends up happening is it starts to take control because it's been compensating. So instead of using these muscles, then these muscles relax and say, okay, the tongue's going to do it. And then we're having issues. Okay. And then with headaches, there's tension. So when it comes to misalignment in the jaw, your jaw is a mirror reflection of your hips.
Did you say hips? HIPS?
Your hips and your jaw. If there is tension on this right side of the hip, when I look at somebody's imbalance, I already know what's going on with that jaw up here.
What?
Yes. So when you're having jaw issues on one side, you're having hip issues on the same side.
I cannot believe how all of this stuff is like working together.
Well, now you understand why I couldn't just localize here.
Yes.
I had to go to the rest of the body because it's critical. Because if I'm trying to treat here and this is starting from here, what am I doing? I'm wasting your time and money, and I'm wasting my time.
Wow. Oh my goodness. I had no idea. I'm blown away.
Yes.
I'm blown away.
So when you start to fix things in those areas,
yes,
then you go into the functionality, you start to see long-term improvement.
Which is the goal.
That is the goal. And then if you got to come in for a little check here and there, a lot of my clients are like, oh, I remember I just did these couple of exercises. I'm good to go. Let's go. For maintenance. Yes. Or they'll come back and say, you know what? There's something going on with my body. Let's go ahead and let's work on that. And then I'll just recheck their swallow, recheck everything, and then they go.
Man. Okay, so let's talk about the connection between jaw tension, anxiety, and stress. Like, I didn't even realize that was a connection, but let's talk about it.
Just think about it. Just think about driving in Houston traffic.
Driving is very stressful, especially in Houston traffic.
Yeah.
Don't you guys have the worst traffic in the U.S.?
We do?
I seen that somewhere. This was years ago.
I don't know. I've driven in New York, so I don't know.
Maybe they took the top spot.
Maybe they're like toe to toe or something like that. So I don't know. Yes. But I'll tell you this. Just think about, I'm just going to think of simply driving. You're driving like this, right? You're forward like this. You're just driving is stressful, but then imagine you had this stressful day at work or with your kid or whatever, something happened, okay? A circumstance. So you're not breathing properly. If you're not breathing properly, right? Not you, but I'm saying if you're not breathing properly, and we're breathing here, that's shallow breath. The more shallow breath you had, the higher your anxiety goes up. Because when you start to do proper breathing, like they tell you, if you're stressed, you're anxious, let's do relaxation breathing, right? That's what you see everywhere. Why? Because you're taking increased oxygen in. Okay. But if you're always breathing like this, and then everything's tight, you can't even move. What do you think? It's all together. It's all connected together, you know?
Yes.
And so stress doesn't cause it. Stress makes it worse. Okay. You may be anxious about something because we all get anxious about things, but if our body is dysfunctional, it makes it worse.
And how do you guys help with that at your facility?
What's interesting is that when you start from the bottom up, you start to see anxiety and stress levels go down. Even if they still have it, you see the anxiety and the stress levels go down because we're working the parasympathetic system. We're working all those symptoms in the body. Okay. And so you see the stress levels go down, and then the patient's ready to focus on a self-care plan, because that's what we do with them as well. Okay. And we do what we call WAMs, weekly accountability
I love it.
meetings. So when you come in, part of our questioning is, okay, what did you do for your self-care today? Did you keep to your plan? What was it? What were the results?
Mm-hmm. I
Okay, so
love it.
it's very integrative because, like I said, one thing is with the next, and so to make them more conscientious, and that's also part of our corporate wellness too, because a lot of our executives come in,
Mm-hmm.
and they are, you've got a high stress job. It is what it is, but how do you manage and take care of yourself so you'll be able to handle that high stress is equally important.
You
Okay.
guys really address the whole person, not just a singular issue.
No, not
That's
at all. It's very
good.
hard, and we call that the sick patient model.
Okay.
When you address a singular issue, I will address that issue, but you will continue to be sick. You will continue to be dysfunctional.
Mm-hmm.
We are more on the wellness model where we have to look at everything. Now, the things that we cannot do, we do refer as well to other people with that either are in the same concept or they understand what it is that the patient needs. But where that's one thing about us, that we do have collaborations to be able to communicate that and advocate for our patients. Because just imagine, we give you all this information, you go to your doctor that you need something from them, and you're like trying to explain it to them.
And they
And
have no idea.
it gets lost in translation.
Yeah.
So we do that advocacy too when we have to talk and say, hey, we're going to refer out here. When we refer, it's not just a piece of paper. Here you go. This is what I need you to do for this patient. It's literally collaborating, saying, this is why I need you to do this, or I need you to check to see if this needs to be done
Mm-hmm.
because of this, this, and this.
Yes.
Okay. And so we start working as a multidisciplinary team, not just with ourselves at Tassel, but with the medical community.
I wish every medical community, every doctor prescribed to that. I feel like
Well,
the
I'll tell you
patients'
this.
lives would be so much easier because normally you speak with the doctor and they're like, okay, you got to call this person. So you call this person, you're trying to explain what the doctor said, and it just goes back and forth, back and forth. You're stressed out, you're upset. I mean, it's the whole thing.
And you get discouraged and you
Yes.
fall off the bandwagon. You're just like, you know what? I'm just going to live with this
Yep.
and things like that. And so that's one of the things that we do implement as part of our program. That's why we're definitely program based. And we implement that as part of our program. And I've seen it all too often. If I get on a phone with a physician or we're emailing each other back and forth, it's quick. We speak each other's language.
Yeah.
Okay. And so it's quick, then the patient relaying the message, because a lot of times when we get the relayed message, you can't kill the messenger, but it's never the right translation.
It's
It's like,
never.
oh, we're going to go talk to them. Let's go let me see exactly what's meant and how we need to tackle this.
How can jaw pain and muscle tension be related to posterior issues? Like, I'm learning so much here that I didn't know things were related to each
Related
other.
to what issues?
Posterior issues, your posture.
Oh, posture issues. Yes.
Hmm.
Oh, wow. Like I said, your jaw is a reflection. Your hips are a reflection of your jaw. So your hips are part of your posture because your core is what keeps you together. Your airway also are your core muscles too. Okay. So if your airway patency is low and your hips are off alignment, you have like a rotation, feet out this way, you're leaning more to one side, especially as women who've had children,
Yeah.
pelvic floor issues, things like that. You're dealing with all of this, and then all of a sudden what's screaming is your jaw, because like I said, you correct it here, you're going to correct it here, but then you got to correct the muscle function.
Wow. And
Okay.
all of that contributes to your posture, like how you sit, how you
Absolutely.
stand.
How you sit, how you stand, everything goes back down to your breath.
Wow, I'm blown away.
So
Like, I've
let's
had so
try it,
many
for example,
moments.
right? You're going to sit like this, right? You're sitting
Yes.
like this. You know how
Yes.
sometimes I'm even guilty of it, okay? But
Yes.
when I remember, you have to switch. Instead, everyone says, okay, I'm going to sit straight. Who works like that? I'm sorry, I don't work like that. You don't work like that.
I know. You can tell you're trying to
Posture like
sit
this, but we're
straight.
like leaning this way. A lot of people are sometimes leaning to the left, but that's their
Yes.
middle.
Oh,
They feel centered.
no.
Yes. So you see like the hips moving this way. Like I wish I had pictures to just show you. Like you could see
Yeah.
that I'm allowed to show you because I have pictures, but I'm allowed to show you.
Right.
Where you see the hips kind of like this, you know, and I'm over exaggerating, and then then you see the head pull this way because the face is like this, you know, like
Wow.
that they're centered in their body. It's centered because that's how the
Mhm.
body's going to center when it's compensating.
But you're not centered
No,
at all.
no, not at all. So if you just treat the jaw here local and you
Yes.
forget about all of this, they will feel relieved of the symptom, but the problem is only going to get worse. So that means if you get a mouth guard, you're going to have to keep replacing that mouth guard. Because guess what? You're going to wear through that mouth guard eventually
Yeah.
because the swallow complex changes the inside of the shape of the mouth. So
Oh,
if you're not
yes.
using it, yes, your mouth changes. Your mouth changes.
Yes.
I even go into dentures because people replace their dentures because they have a swallowing issue and it changes the inside of the shape of the mouth. So they got to keep replacing their dentures. Same thing with a mouth guard. It changes because your body is meant to function in a certain way and it's meant to hold everything together. That's how beautiful it is.
Oh,
Okay.
wow.
And so when it's not functioning in there, you don't have anything holding that palate open, your retainer. We say your lips are your face's braces and your tongue is your natural retainer. You
Yes.
don't have anything holding it there. It starts to narrow in. And now we have postural issues, head issues, everything, all this tension because your body's just trying to survive.
Right.
So sometimes when you're sleeping, remember I said that airway minimized, the tongue falls in, the throat, they say you have like a minimized airway. Some people wake up choking, nightmares. Wake up just when you wake up just like that, it's because
Hmm.
you couldn't breathe and your body woke you up.
Wow. Oh my goodness.
Yes, your body woke you up to say, hey, don't die. Yeah.
Thank goodness for the body.
Yes, yes. But at the same time, yes, you woke up and then you can't get back to sleep and you're walking around brain fog all
Yeah.
day, you know?
It all goes back to like one another. Everything you've been talking about since we started this podcast.
Yes.
It all goes back. Wow. Okay, what are some common experiences or symptoms that bring a lot of your clients into your facility?
So the common thing is jaw dysfunction.
Okay.
So everybody's TMJ. I have TMJ. One of the biggest common things too is that they're looking for somebody, they're looking for this pain to go away. And then sometimes it comes back and forth. But that is the biggest one that gets them that they come in. And then when we look at, okay, it's TMJ is a symptom. TMJ disorder is a symptom of so many, it's a systemic thing. So it's
Yeah.
so many other issues. So when we do a comprehensive examination, we're looking at 6 different modalities that are underlying for this symptom. Okay. Now we do consider hormones because sometimes that also impacts the jaw, but
Hmm.
we also check your lymphatic system too.
Are you
Okay.
seeing increase in clients with TMJ, or has it? Okay, so you're seeing an increase with it. Is it something that we as a society are doing?
Absolutely. The reason for the jaw was made to crush. I call it, it's a crusher, you know, it's a jaw
Okay.
crusher. What are we doing half the time?
Oh, drinking something?
Out of the straw.
Yeah.
And everything's soft. Think about when you go out to eat. Let's say you're gonna get fast food. Okay. I'm not a
Hmm.
big fast food eater, but you're gonna get fast food.
Okay.
Think about the texture.
Yeah, it's soft.
It's soft. Okay.
Yes.
Think about even some of the kids who are a little bit more pickier in eating and adults. It's easier
Hmm.
to eat a soft little hamburger or even French fries.
Yes.
But what happened to the raw vegetables? Those are the things that really get to really chew. Okay. And to build like natural foods, to be able to
Mm-hmm.
build the jaw muscle, you have to build the jaw muscle. Okay. And so you see that, I see that where it's really our diet in our first world country. It's our diet.
Wow. So we really do need to go back to eating natural, healthier, what the earth gives us food.
Yes. Everything, I always say, everything we do through a straw, smoothies,
It is.
Starbucks.
Yeah. Yes.
If you
Water,
can get in a straw and
something.
to go, not even using a spoon, we're in such a rush in society that we should at least, if you're going to eat, don't eat in your car.
Mm-hmm.
Or if you're going to eat in your car because you have no place to eat, stop, take 15 minutes and eat and focus and chew. And I say that because with kids, especially, even adults, I give them when they're eating, they're not even putting their lip on the spoon. And us women, we were taught not to get our lipstick all into the spoon. Okay, I get it, but it's a natural trigger for the perfect swallow.
Really?
Your lips, yes, it's a natural trigger. If you had a puree, I would ask you to try
Wow. You asking a lot, Alizah. You asking a lot. Don't eat in our car? Like
it. Yeah.
what?
Well, you can eat in your car, but stop.
Stop?
Stop.
No.
You got to
You
stop. Take
asking a
15
lot.
minutes. Yes.
You
15
asking a
minutes out of
lot.
your day. One, you're going to be able to connect with your body. Okay. But
Mm-hmm.
being able to chew, because half the time, if we're driving like this, what do we give the kids? Everything to suck on, so it doesn't
Yes.
fall in the car. We have
Yes.
stuff that's easy to eat fast,
Mm-hmm.
so it doesn't fall anywhere, and we can be done with it. We can not be hungry anymore.
Yeah. Quick
So
fixes. Quick fix. Quick fix. Wow. Okay, we've spoken a lot about different chronic conditions. Let's talk about your holistic and integrated approach to some of these conditions. So, for patients with conditions like sleep apnea, things like that, what are like your holistic kind of integrated approaches to help with that?
okay. So first and foremost, I just want to kind of mention that the conditions we treat jaw dysfunction, we treat
Hmm.
swallowing as well as airway issues. Okay, so
Okay.
that goes, and we also do jaw surgery recovery, which we haven't even touched that. There's a whole different thing there.
Yes.
But with these, with our patients, when we treat them, when they, like I said, when they first come in, we have to do a comprehensive. We have to figure out why this is happening. And then once we do, we create a customized treatment plan. Even though we have our program and we have our method, it's very customized to our customer because one client will need something that someone else doesn't because they're not dealing with
Hmm.
that particular issue with posture or airway or something like that. So once we create that dynamic treatment plan, we take you through a 3-phase process.
Okay.
The end goal at the end of the day is what we want. We want no jaw pain. We want no clenching and grinding if you're dealing with that. And depending on the customer, we want to sleep better. We want it. And then, like I said, they'll come up with, oh yeah, I kind of struggle a little bit with swallowing. So they want to be able to be free of that and not have the brain fog. So we take them through a 3-step phase. So we'd start with the body, the airway, and then the function. And
Okay.
so with that, we provide different approaches when it comes to the body. There's manual techniques. We utilize different things that the body's needing at the time. So it's not just one modality. It could be, for example, let's say there's an increased tension. We may utilize red light and manual therapy.
Okay.
We may have to utilize cavitation. We may have to utilize because we have to drain your lymph nodes. It just depends on what your body needs. That plan is there, and we're addressing those issues right then and there. And whatever we cannot address, we're referring.
Okay. Okay. Again, I love, and I know you're my guest on this podcast, so I'm trying to be impartial here, but I love how you guys address the whole person.
Mm-hmm.
I love it. And, one thing for me that I'm noticing is for the most part, your clients don't have to go to 20 15 different people and doctors and appointments here. Like a
And
lot
then
of the
try to still
stuff,
figure it out themselves.
yes, a lot of the
Yeah.
stuff you guys are providing at your facility.
Hmm.
Oh my goodness. Yeah. Yeah. Okay. So what benefits do your patients, your clients see when addressing underlying airway issues?
So from day one, I'll tell you this,
Hmm.
from day one, when we start to address those underlying issues, what those underlying issues, the benefits that they start to see first and foremost is that they can breathe. They've learned to breathe the first time, and it's not just saying breathe in, breathe out, breathe in. It's their
Right.
body naturally utilizing their their natural system, their natural ventilation system. And it's amazing to
Right.
see, because when you start to relieve tension in certain areas of the body, you hear the patient automatically go, what was that?
Yes.
We hear that all the time. What was that?
Because that's new.
Yes. So that's the benefit. They start to realize, wait a minute, I can do this. I was never able to do this.
Hmm.
I can do this, and it's natural. So that's the amazing part on our end too, is that when we start to probe the body in the natural function, the body takes over. It's like, hey, I know what I'm doing. This is what I'm supposed to do.
That's exactly what I was gonna say. Like your body starts doing exactly what it's supposed to do,
So the
what it was
benefit is
designed
that
to
they get a
do.
new normal, they have hope, and they realize that they reversed where they're going, where
Yeah.
they were going. So that's the benefit, that they can breathe. They're able to eat. Their quality of life has increased too, because like I said, the one patient, well, she was at 37.7. When
Hmm.
she was complete, like she was been a year in with us, she's actually mild at 10.3
Wow.
off
Now,
the
is that
CPAP.
average? Like in the tens?
10.3 is mild. So
Okay.
under 5 is where we want her to be. So we do have a maintenance program that we're implementing, some other new things that we've added that we're seeing amazing results with it too, to get her under a 5. But from
I
going
mean,
37.7 down
to a
to
10?
10.3 in it was a year's time, okay? But 6 months into that, she was completely off the CPAP.
Yes. Her whole life has changed.
Yes.
Her
And she doesn't
entire
look
life.
gray either.
Yeah. She got a color back.
You can go on our Instagram page and see her as well.
Hmm.
So you don't see she doesn't look gray. She is her husband's like, I'm not taking care of a sick person anymore.
Yes. And that benefits him too. In the
Absolutely.
marriage, I mean, it affects so many aspects
Yes.
of
And
her
she's
life.
starting to do and she wasn't, by the way, she was not a big woman at all, very
Hmm.
slender woman. She's walking the beach with her husband. She can go
Oh,
food shopping with him.
oh,
She does her workouts every day. She's on the treadmill too. She's like, I'm not, she does about maybe 15 minutes in the treadmill. She wasn't even, we first attempted it, she was like, really? And when she saw she was able to do it without getting winded, for a certain amount of minutes, and when we
hmm,
just kept increasing that as well, it was just amazing to see that she was just like, when she went to her, I guess she went to her church, and she was like, the guy's like, you keep getting younger. Because if you look at her pictures, she looks like 10 years younger.
wow. That's amazing. That's
Yes.
amazing. Okay, we are coming up on 1 hour. Can you believe it? I can't
I can't believe it. It
believe
was fast.
it's gone so fast. Oh my goodness. Okay, I feel like I could talk to you for a whole nother like 2 hours about this. But as we're getting ready to wrap up, let's talk about jaw surgery and the recovery that you guys help with.
Yes. So one of the things that is in my little soapbox with jaw surgery,
Okay.
when you are far gone with your jaw dysfunction, it will lead to jaw surgery.
Hmm.
Okay. So a lot of the stuff we do is to try to prevent you from going in that direction. That's when it's
Yes.
really far gone. So when it is that far gone, we do provide what we call jaw surgery recovery. And what's interesting, when we started to provide this program, what's interesting is that if you look at the research, 60% of people who have jaw surgery relapse.
And they have to get the surgery again?
Many of them have, or they just kind of live with the condition. Okay.
Yes.
So that's relapse. And it's to say, oh, I don't want to do jaw surgery. Okay, if you're that far gone and you have to do it, I'm not advocating to do or not to do.
Mm-hmm.
I'm saying this. The reason why you got there was because of muscle dysfunction. They are cutting into bone because they
Oh,
had to, but your muscles are still functioning the way they used to. So if muscle moves bone and you have this beautiful new face now that you paid 50 to $90,000, okay, because it's not cheap, and
yes.
it's very invasive, okay, and the recovery time takes time, and you're still functioning the way you used to, guess what's going to happen 3 to 5 years down the road?
Because your
You're going to have
face
the same
changes.
team,
Your
TMJ issues. We've
yes.
seen people who don't have the proper treatments afterwards, and they come in and they look like they were 2 months post-operative because their inflammation was out the water. It was like, I was like, when did you have the surgery? It was like a year and a half, and their face is still swollen as if they just came out of surgery 2 months earlier. Okay. So I explained this to the oral surgeons too, because I'm talking to the oral surgeons. I said, if you get knee surgery, you get rehabilitation for your knee. Why wouldn't you get rehabilitation for your jaw?
Yes.
Okay. And also, we work the airway, because just because your face is in the proper position, your structure is in the proper position. It's kind of like I gave you a tool with no instruction manual. So you're going to use it the way you think it is,
Yeah.
with the way you know how to use it from
And you've
before.
been using it wrong the whole time anyway.
Yes. Okay. So with our jaw surgery recovery program, we do meet with the patient prior to, we do provide what we see from a muscular level to the oral surgeon so that they can
Mhm.
consider it in their surgical plan.
Okay.
Okay. That's before. Afterwards, we target the inflammation. We target the cranial nerves to the facial nerves that you end up losing because, the body has to come back. We trigger those. So you're going to get them back faster than you would if you didn't even bother with it. Because a lot
Yes.
of times, like I said, the people with inflammation coming a year and a half later, they still can't feel their chin. Okay. They don't know where their tongue's supposed to be. They don't know how to
Wow.
chew. Like you feel like I know it's changed, but where is everything supposed to be? How is
Mm-hmm.
everything supposed to function? We get you doing that properly so that that costly surgery is going, you don't relapse. You don't have to deal with these issues down the road. You keep going in in the positive direction. I always tell
Yeah.
our surgeons, we make you guys look good. You guys
I'm
got
saying.
because I've had patients literally come in and be like, did I make a mistake? Did I do this? Did I?
Yes.
And then when we reduce that inflammation like this, they were like, oh, I said, he did a good job, you know?
Yes. Yes.
Yes, he did
Oh.
a good job. So, yes, so we work on all those aspects because the jaw is primary. Basically, the swallow complex is primary to the jaw.
Mm-hmm.
So we make sure that swallow complex is working so that the jaw is functioning properly as well.
And I know you probably don't have the answer to this, and I don't want you to get yourself in trouble, but I just feel the need to ask, why aren't the doctors that are performing these jaw surgery, why is rehabilitation not part of that?
For jaw surgery, that's a question that I asked them. I said,
Why?
I said the same question I said before. It's why wouldn't you do that? They just didn't consider it. It was just not considered. And I just think that sometimes we're looking at things from one perspective, and you have many amazing, I've worked with and I've seen the result of many amazing oral surgeons, okay?
Yes.
But they're not educated in the form of how to put that connection. But once you explain it to them, they understand 100%.
Yeah,
It's about protocol. Everything when it comes to the medical system is about protocol. And if that
it
was never
is.
in the protocol, it's never a thought.
Mm-hmm. Yes.
Okay.
Yes.
So, and usually when you're in the hospital system, you don't deviate from protocol.
You do not, because you can
Okay.
get sued.
So even if you're on the private sector, that's where you were trained.
Mm-hmm. It
So
is.
I don't put all the blame in a sense on them. In that sense, it has to deal with the system.
So the system needs correcting. What would be your top piece of advice for someone preparing for surgery or recovering from jaw surgery?
So first and foremost, depending on who you go to for oral surgery,
Mm-hmm.
because there's many different oral surgeons that work differently. Okay, so definitely to prepare yourself, you need to ask the right questions to your physician, just kind of what to expect, what do I need to eat. You need to make sure you get your family on board. Okay,
Okay.
because you're not going to be able to move like your mouth, you're not going to be able to eat. So make sure that you have what we call a pureed diet. That's some of the things that we provide too. We provide some recipes, give clients ideas of what to do. You need to make sure you prepare that and how you plan to eat that as well. We give them bottles too,
Mm-hmm.
like adult bottles,
I was
to
about to say, yeah,
yeah,
okay.
to be able to squeeze in. It's not, a lot of the surgeries are not like before where they used to wire your jaw shut. Sometimes you have that. It just depends on the surgery. But let's say it's like a double jaw surgery or something like that in MMA. And so you basically, you have to have the right questions. You also have to have your therapy, your rehabilitation set up really
Mm-hmm.
well. Okay. You have to actually ask them too, in regards to time frames and timelines too. Another thing I tell them too is to ask about if they're going to move the jaw forward. If we measure a narrow palate, can they open up the palate, or does that need to be done afterwards as well?
Okay.
Okay, because sometimes we've seen anterior growth but not lateral growth that we needed as well. So those are some of the things too. I would say definitely get in, to get a preoperative assessment, at least a preoperative assessment before you go in. The other thing too is, outside of preparing yourself for the inflammation and things like that, definitely have your rehabilitation afterwards, and then also your oral surgeon connect to whoever you're doing rehabilitation with.
Okay. Okay. How does Tassel Health, and I love this question, how does Tassel Health help to empower your patients to speak up and advocate for themselves in their health journey?
So throughout the whole process, you are literally in a rabbit hole of education.
Yeah.
Okay, as you're going through, and then as we're collaborating and also advocating for our clients with whoever else is on their healthcare team, our clients understand what is going on with themselves. Maybe not to the level we do, but enough where they understand where if they need to ask the right questions, or maybe look for additional things that they can add into their lives that we do not provide. Do you understand?
Mm-hmm.
And so basically they're educated from the time they get started all the way till the end. And what's great, and what's great for our clients too, is that sometimes they come back and they give us some great ideas too.
Oh,
Yes, because everybody's different as well.
yes. Yes. Well, you have been amazing on this podcast. Thank you so much for saying yes.
Well, thank you for the invitation.
Absolutely. So, my final question for you, who do you think would make a great guest on the podcast? But you have to help me get them on.
Well, there's a couple of people, and I'll tell you, Houston has a wealth of wonderful medical professionals, especially on the functional holistic side.
Hmm.
We have Dr. Vivian Azamoa from the Houston Gastro Institute, and we have also Dr. Carmen Baez Franceschi from the Wellness Institute of Neural Development.
Excellent. I cannot wait to have them on and learn from them as well.
Absolutely. You guys are going to get a lot from them.
Yeah. Excellent. Excellent. We have an hour to fill. So, yeah, we have an hour to fill. But thank you
Okay.
so much for being on the podcast. I appreciate
Well, thank
you.
you for having me. It was nice to have this conversation.
Hmm. And to my listeners and my viewers, thank you so much for tuning in and listening. You can get this podcast and all of my other podcasts on YouTube Podcasts and Apple Podcasts. And remember, you always have time to listen and learn on the go.